now I have my sterile field all set up. I'm going to go to my patient and remove the dressing. So I'm going to carefully remove the abdominal pad, and I'm going to have a look under, assess the drainage, the amount. So it looks like moderate serosanguinous drainage, and then I'm going to check under that, and then I see the packing. So I can dispose of this. And I'm going to need my forceps to get this packing out. So I'm going to take, and once I use this, it is considered contaminated. And I'm going to kind of estimate, have a look at the amount and drainage of my packing and dispose of it in the garbage as well. And this contaminated, I'm disposing of that. Now I'm going to assess the wound. I see redness, a bit of edema around. I see some serosanguinous drainage. I could check for tunneling. So I have some Q-tips on the side over here. Sterile Q-tips. So same method to open. And I will check for tunneling. And then I could also check the depth. And what I would do here is I would get my ruler and I will measure the depth. So it looks, I'll estimate about 3 to 4 centimeters. And I'll remember that, and then I could estimate the wound. So about 14 centimeters by 3 centimeters. 14, 3, and 3 to 4 centimeters for depth. No tunneling. So now that I've assessed the wound, I'm going to clean it, and I'm going to clean it by irrigating. I'm going to make sure I have everything I need for irrigating, and because this is when I'm going to switch for my sterile gloves, kind of go through the steps again for the packing to make sure I have everything I need. Otherwise, I'll have to call a nurse to help me out. I will need Q-tips though, so I'm going to put that in because when I pack, I might need that extra Q-tip to help pack there. So I'm going to open that up. And carefully drop that into my sterile field. Okay. All right, now I'm going to take off my gloves and my hands and put my sterile gloves on. So you want to find an area to put your sterile gloves on where you're not going to kind of touch your sterile field. So I'm going to ask my patient if I could use this area. Going to create the sterile field with my. Okay, so I am right-handed. I'm going to put my right one on first. That one's good. I can touch this one anywhere I need to. These ones might be a little bit tight for me, but I'll make them work. Sterile gloves are on. I can start irrigating and packing. Now I can only stay within my field and there. So here's my syringe. I'm going to pull up 30 mils. And I'm going to put my cannula on. So make sure you know how to remove. Just the plastic part is what I need. And so I'm going to press the button and only keep this part here. And make sure you put your sharps somewhere that you will remember to dispose of it in the sharps. Okay, so now I'm going to irrigate from the cleanest area of the wound to the dirtiest. So I'm going to start in the center here. And with some pressure, keep your cannula about a few centimeters above the wound, and you want to irrigate until your liquid runs clear, until your drainage runs clear. Okay. And then after that, I'm going to dispose of this, and I'm going to dry the wound. So I can use my hands or I can use my forceps. So if I'm going to use my forceps, so I can put this inside the wound and kind of lap up that excess drainage. making sure not to touch the wound with my forceps. Then I'll dispose of that. If you need another one, you do it again. And then I'm going to clean around on the peri-wound area with my 2x2s. Put it in some saline. Do one. One swipe and it's dirty. And then I would dry. So I'm going to use my 4x4s to dry the peri-wound. So one swipe, dispose. Make sure you drop your garbage about 6 inches above. Okay, so I'm going to make sure the wound is dry before I start packing. And then now I can start packing. So you want to get your Curlix and you want to wet the whole thing, or you can estimate how much you might need. So I'm going to estimate because I don't think I'll need this whole thing, but overestimate and then cut off the remaining. So I'm going to say about that much. Cut. You only want to pack with one piece, unless it's a very big wound and you have no choice. Then I'm going to take this and I'm going to put in its normal saline soaked packing as per orders. I'm going to drain the excess. And then I'm going to start packing. So I'm going to put this in one, and then I'm going to use my Q-tip to pack. So make sure you are in the wound and not touching the packing outside of the wound itself. So you can see how the Q-tip part is kind of sticking to my packing. So some people can use this end. You just have to be careful not to nick the wound. You want to pack it so it's loosely packed, but everything is, the wound is packed well enough. I'm coming to the end here. You can also use your gloved hands because it's sterile, as long as, again, you only touching the packing. Okay. If it touched a little bit of the peri-wound, that's fine because you've cleaned that area. So I'm done with that. Now I'm going to cut. Pack the rest in, making sure it's packed fully but not too tight. Okay, then I'm going to put my dressing back on, which was 2 4x4s. Then my abdominal pad. I can consider myself not sterile anymore, so I could touch this package. The only thing you've got to keep sterile on the abdominal pad is the part touching the dressing. So you can touch the blue outside of this. So just open it up. This area has to be kept sterile. And then putting it on. And then we'll tape it. And at this point you could take off your gloves if it's easier. There it is. Tape it down. And that's it.